Rick Westover. Welcome to Ask the Specialist here on CMU Public Television. Tonight, we ask the doctors. Thanks again for joining us. We're glad to have you with us because without you, we really don't have a program, do we? It's Ask the Specialist. So we need your questions to get us started. Please give us a call, 1-800-727-9268 to ask your question today. That's 800-727-9268. You can also reach out via Twitter. We're at WCMU_AskThe, and you can also ask your question, #AskThe, to find us that way. And you can also reach out via Facebook. We're there under Ask the Specialists. Again, I'm Rick Westover, joined by our guest today from McLaren, Central Michigan, and I want to introduce Dr. Rami Safadi to the program. Dr. Safadi is a specialist in interventional radiology.
Yes.
And sir, welcome to the program, and let's
Thank you.
talk about that specialty so our folks know what kind of questions you might be able to field for us
Well,
tonight.
interventional radiologists are specially trained physicians that are trained in minimally invasive procedures that does not require surgery, procedures that are technically advanced, and we use imaging guidance techniques to get to various parts of the body to treat conditions. One of the conditions we treat, like vascular disease, peripheral arterial disease, and venous disease. But we use minimally invasive techniques for patients that's lower risk and does not require surgery as an alternative to surgery.
All right, very good. That's Dr. Safadi, specialist in interventional radiology, again with McLaren, Central Michigan. Our other guest, Dr. Daniel Wilkerson. Welcome, sir, to the program, a specialist and actually the director of emergency medicine with McLaren, Central Michigan. Welcome to the show. And tell me about some of the key things that sort of come into your daily life as you're heading up the emergency department there.
Well, it's typically a seasonal, we see several different disease processes, mostly on a seasonal nature. We get a lot of times chest pains, anywhere from strokes, things like that. Infections and stuff come in seasons though, and most of the time we see heading into pneumonia, flu type seasons. We see a lot more respiratory illnesses, more in the fall. But we see a gamut of everything, broken bones to various illnesses.
Very good. As we get underway then, let's talk a little bit about one of those seasonal issues that you brought up, the flu. How do you know, one, when maybe you're suffering from said flu? When do you seek treatment and the like? When should people, especially heading to the emergency room for flu, what kind of symptoms are you looking at, and when might be a good time to head out and seek help?
Most people think that the flu is a stomach illness. However, influenza itself is a respiratory illness. It's you typically get a fever, dry cough, shortness of breath, and you can typically get pretty sick with it, provided you're not vaccinated appropriately. Patients that are at risk for this are usually the elderly population and the very young patients, as well as other people that may be immunocompromised for whatever reason, whether they be on chemotherapy or medications that would lower their immune system.
All right, appreciate that. Dr. Safadi, a question about leg cramps. They get leg cramps in the evening that ease with real hot baths. Is this PVD? One, I'm not familiar with PVD, and then would somebody specializing in interventional radiology be able to help in this area?
Very good question. It's called PVD, or peripheral arterial disease. It's a blockage of the arteries or buildup of plaques of the arteries, and compromise to the of the flow to the legs. When that happens, patients start having pain and cramp. And it's always consistent when they walk. When they walk, they start having the cramp. They put their hand on the thigh or the calf or on the calf. They can't walk a distance, so they have to stop. And that's typical of peripheral arterial disease. When it becomes more advanced, the distance they can walk is less and less, and then they start having pain at rest, and that's when it's severely advanced. We'd like to treat those patients early on when the disease is not advanced, and we can help them get on with their life and be active. The best thing is to do is to prevent the disease process, treat the risk factors before we really treat those patients or have any intervention of those patients. Prevent the disease, stop smoking, treat all the risk factors, we can get to those. But yes, interventional radiologist does treat those conditions. We have minimally invasive techniques to treat those conditions, and most patients can go home same day or next morning, and they can go back to normal activities in 3 days.
Oh, very good. Well, appreciate that. Thank you. Dr. Wilkerson, a question out of Clinton Township. This person says that they've had sodium and potassium levels that were low in lab work. What could cause this?
There's several different factors in which could cause a low potassium and a low sodium. One of them is typically medications. Probably if you're on any type of diuretic medications, most of the time that can cause an issue with your electrolytes. However, it can be signs of another more problematic condition, and that they should definitely follow up with their primary care physician to get those checked out. Most of the time it's not anything to be concerned about, but occasionally it can be signs of something else. So definitely to follow up with the primary care physician would be important to deal with those type of electrolyte imbalances. All
right, thank you. A follow-up on the flu. How safe is the flu shot with the FDA closed, et cetera? A note here from a female listener out of Saginaw. How safe is that flu shot?
Even though the government is shut down, pretty much all of the work that has been done getting the flu shot ready has been while the government was open. So there's not really any concern as far as the safety is with the flu shot. There are certain side effects that can happen with any type of a vaccination, but I don't think it's any more dangerous now that the government shut down. So.
All right, very good. A question out of Lewiston about lichen planus orally. What would help with the pain diagnosed through a biopsy of lichen planus? I'm not sure what that is. If somebody can clarify that, and then.
Yeah, lichen planus is a dermatologic condition. It's kind of, you get a plaque-like rash that can happen. Sometimes that can be accompanied by pain. Typically those are handled by dermatologists, and I would definitely speak with them. A primary care doctor can certainly suggest options for pain control with this disorder. Ultimately, you can go to a pain specialist as well. That's also another option. Typically, if you have that issue, it's usually not something that goes away right away. So sometimes chronic pain management is necessary.
All right, very good. Thank you very much. Dr. Safadi, a question about abdominal aortic aneurysm. Somebody's got a concern about this part of their anatomy, and I'm curious what you can tell us about that. When do you know that there's an issue? When do you know that you need some support medically?
This is a very important question. I think I'm glad you asked the question, because most patients that have abdominal aortic aneurysm, they don't know about it. It's asymptomatic disease, and unfortunately, a number of those patients do come to the emergency room with ruptured aneurysm, and that's most of the times 50% of patients don't make it. So it is important to screen for abdominal aortic aneurysm and know the risk factors for abdominal aortic aneurysm. Patients that have family history of people that had abdominal aortic aneurysm after age 50, they should screen, especially if they're smokers and have hypertension. They should be screened for abdominal aortic aneurysm. It's a condition that can be treated, and there are minimally invasive techniques that we treat abdominal aortic aneurysm. Here at McLaren Central Michigan, we do treat them. We have state-of-the-art equipment that we treat abdominal aortic aneurysm with, and they're very successful procedures. Nowadays, patients can go home in a day or two after an abdominal aortic aneurysm treatment.
All right, very good. Dr. Wilkerson, a caller out of Brimley, a female caller, noting that her son has heel spurs. Any help for those heel spurs?
I would probably, you probably defer that to the primary care physician. There are some orthotics and things like that that are available for that. Physical therapy can also be an option as well. Sometimes it's not necessarily a heel spur itself, but can be signs of inflammation of the tendon that goes on the bottom of the foot. That can sometimes cause pain, and icing and stuff can sometimes help with that. Non-steroidal anti-inflammatory medications such as a Motrin would also be helpful in that regards. But ultimately, if you definitely want to keep in touch with your primary care doctor about what you can do to prevent this from happening, whether it be change your running habits. Sometimes it's a shoe change. Things like that can be of help. And I guess it would be dependent on what's causing the heel spurs themselves. Would be kind of how you would treat it.
All right, very good. Question coming in through Twitter, and remember that you can reach us on Twitter at WCMU_AskThe, or just simply put #AskThe in your question. And this just for sort of a general question for both of you. What are your thoughts on genetic testing, if you wanted to speak to that for just a moment?
I could start. The genetic testing itself, I guess, it would be good to determine if there's any genetically things that run in your family. However, it can be kind of a double-edged sword too. You don't want to, be susceptible for something, not necessarily having a diagnosis of something, and then be concerned about that to the point where it interrupts your daily living. So it can be helpful in certain regards. However, it's not always. There is some drawbacks to knowing what you may have, in your family's history. So.
Sure. I don't know if you want to
I think it is important to know that this is available to patients, genetic testing, especially in cancer conditions. Certain cancer conditions, it runs in families, and genetic testing is important to know, at least to know the risk of having that condition. I think it is important for patients to know that this is available if they are concerned about something, whether they may have that condition that their family member have. If they can ask whether there is a test that they can have to genetically know if they are predisposed to that particular cancer or not.
Sure. All right. Dr. Safadi, I'll follow up with you as well. Caller out of Detroit noting blood clots. They had surgery last April. Nothing seems to be getting better in terms of their legs. They're still swelling. The legs feel hard, and it's difficult walking. They've noted that a greenfield filter is in place. I'm not familiar with that.
Yes.
Maybe you can describe it, but and nothing's getting better. Any thoughts for this person?
Well, I think the caller is referring to blood clot in the veins, because blood clots can occur anywhere in the body, in the artery or in the vein. So from the question, I think he's referring to blood clot in the vein. A greenfield filter is a screen device that is placed usually in the large vein that drains blood from the veins in the legs. So when a clot forms in the legs, the body will try to get rid of the clot, and there is a mechanism that the body does to get rid of the clot. Unfortunately, by doing so, the body will start forming scarring in the veins, and that scarring in the vein destroys part of the vein and part of the function of the vein. So patients start having swelling, start having discoloration in the skin. Unfortunately, there isn't much after the fact that the clot formed and the body took care of the clot. There isn't much that, as far as intervention that we can do to help those patients, other than stockings and certain non-invasive methods to treat those patients.
All right, very good. For Dr. Wilkerson, what determines if you get stitches or glue to close a laceration?
Typically, the glue is not terribly strong. So if you're gluing a wound, it's usually on a site that doesn't have a whole lot of tension involved onto it. If you have a laceration over a joint, say an elbow or something like that, where it bends, there can be a lot of stress on that laceration itself. We typically do glue on the face, arms, things like that, where there's not a lot of stretching forces involved there. The glue itself is comparable to stitches as far as the way the laceration looks after you repair it. However, if the glue should happen to fail, we can't really go ahead and put stitches in after the fact. So it is limited in that capacity. That's usually why we use it typically on eyebrows and chins and things like that aren't moving a whole lot, because it does have a tendency to pop open if it was under stress. So.
Okay, very good. Dr. Safadi, a caller out of Waterford noting it looks like multiple organ transplants, an intestine, liver, kidney, pancreas, a transplant patient who has been diagnosed, or excuse me, has been prescribed rather, 8 milligrams daily of Coumadin. Is there an alternative to Coumadin is the question.
Well, there are alternatives to Coumadin nowadays, and whether there are candidates for those alternate therapy, I think it requires some investigation by and some visit to their family doctor or their prescribing doctor. There are alternatives to Coumadin. Coumadin has been around for a long, long time, and it's been effective.
What its role is in that situation?
Well, the Coumadin is a blood thinner. They use blood thinner to prevent any clots from forming on those patients. They are prone to having clots, so they use blood thinner to just prevent clots forming.
All right, very good, thank you. Dr. Wilkerson, a question out of Kingsley. Can you get salmonella poisoning that affects your gallbladder? Can it isolate within the body like that?
I don't usually see that. Most of the time, acute salmonella infection is due to tainted food. Most of the time presents as a GI illness. It is a bacteria, whether it can certainly seed the gallbladder, and you could have, ultimately, if you have your gallbladder taken out and have cultures on that, I guess that could have salmonella in it. However, it typically doesn't present like that. Most of the time it's an isolated GI illness with nausea, vomiting, diarrhea, occasional fever.
All right. As I look at the malady on the page, I don't know who to direct my question to, so I'll ask it, and if either one of you want to tackle it, feel free. How do you treat neurofibromatosis, and what is that?
Neurofibromatosis is a disorder where you develop several growths on the skin, all over your skin. Sometimes it can cause neurologic problems. It's usually typically treated symptomatically with surgeries if there's a particular neurofibroma that's causing the problem. A lot of times they'll excise that through surgery. Other than that, I would definitely defer that back to the primary care doctor. We don't see that very often in the emergency department, or I think in interventional radiology. Yeah, I don't know that we don't see that a whole lot. So.
I appreciate your answer then. Thank you. A caller out of Remus, an 81-year-old male who has been dealing with a rectal hemorrhage, had polyps in his colon removed, and gas is an issue now. Is this normal as you go through this procedure?
I'm sorry, can you repeat the last?
Sure. An 81-year-old male suffered from a rectal hemorrhage, had polyps in the colon that were removed, and now since that surgery, there's an issue with gas. And is this normal after such a surgery?
You may want to answer that.
I think that's probably kind of a general. I don't think it's related directly to his problem with the rectal hemorrhages. However, reduction of gas can be done by several different medications, a gas X or something like that over the counter. Sometimes it's restoring the normal balance of bacteria you have in your colon, using a probiotics, taking they're available pill form, same area where you would find antacids in the supermarket, or you can use it by eating yogurt. Activia yogurt is kind of brands himself on be able to have that bacteria in it that restores normal digestive function. And a lot of times that eliminates gas, and certainly eliminating gas-causing foods in your diet, a lot of beans and things sometimes can cause gas, as well as carbonated beverages can cause gas too.
Okay, so maybe not a direct tie back.
Yeah. I mean, if you're worried about eliminating gas, those would be some of the things you could try.
Very good, thank you. Another question reaching us through Twitter. Again, we're at WCMU_AskThe, or use hashtag AskThe to ask your question. How can you tell if something is viral or bacterial, and when should you see the doctor? And maybe you should just go, because you'll be able to tell me better if I have a bacterial or viral infection, but maybe you want to go ahead and
That's a good question for us too. Sometimes it's very difficult to determine what is going on. But definitely, if you have any type of concerning symptoms, shortness of breath, high fevers, unable to keep any medications down because you're vomiting so much, more likely to come in if you have severe symptoms that you can't handle with typical over-the-counter medications. Those would be reasons to either seek medical attention through your doctor. And typically your doctor's office has an on-call number. You can start by calling your primary care doctor. A lot of times they'll call you back. But if you're unable to get a hold of somebody, if you don't have a primary care physician, the emergency department's always open.
All right, very good. Dr. Safady, a woman 72 years of age notes that she's in generally good health, but 3 out of 7 nights she's awoken by leg cramps. And I'm curious if this might tie back to the peripheral arterial disease that we talked about. How can she know whether that's an issue for her and what
well,
should she do?
as I said earlier, peripheral arterial disease, the symptoms are the same and consistent every time. It's usually when they walk. If they notice they're having the cramps when they walk, and usually it starts at a long distance, and then as the disease progresses, the distance shortens. So it's more likely to be a peripheral arterial disease if they have pain when they walk. Cramps is a common problem, and it can be electrolyte imbalance, especially when people don't have cramps when they walk or cramps when they do activities, cramps at night. It's probably not peripheral arterial disease, but it would be a good idea to be checked with non-invasive study to know exactly whether they have peripheral arterial disease. There are many non-invasive studies that can be done to detect peripheral arterial disease. Yeah.
Okay, thank you. Dr. Wilkerson, a caller out of Clare. If you have chronic pain in the right side of your abdomen, what could this be? Is this common? Is this something that should be followed up on?
I guess it would depend on if the patient, there's certain anatomical things that are present on the right side of your abdomen. Liver and gallbladder are on more of the upper right area. So if you haven't had an evaluation of your gallbladder, that'd be something that could be looked into. The right lower quadrant in females, you have your ovaries on that side. Your appendix is, for both males and females, is on the right lower side. Typically, an appendicitis attack usually would progress. It usually doesn't get better. So if you're dealing with pain that's sometimes, if you've had surgery before, you can have scar tissue in the area. And other, sometimes it could be an issue with a nerve impingement in your back as well. So kind of a lot of different factors. Like start with your primary care doctor and get it checked out. They might have to refer you to another physician,
Sure enough.
surgeon or something like that.
If it's something that feels out of sorts, follow up.
Sure.
All right. A caller out of Howell noting that their daughter is 43 years of age and has had 4 heart attacks and has not had any surgery for this because they're throwing multiple blood clots, so they're unable to have surgery apparently. Are there any kind of tests? Is there any kind of option out there for her in this situation?
Well, what I would suggest, as an interventional radiologist, I don't deal with cardiac conditions. I would suggest to that caller to refer to their cardiologist or their primary care physicians to know more about her condition. As an interventional radiologist, we refer those patients usually to a cardiologist to take care of it. So.
Okay, very good. Question for you, Dr. Safady, out of Alpena. LVAT, what is this? Stumper?
Yeah, she'll have to help me with that.
Okay, that's all I have. We'll set that one aside. Yeah. I have a question out of Thomas Township. If you are a diabetic, what are the best supplemental vitamins? They note here alpha malproic acid. Is this something that would be good for a diabetic?
As an ER physician, we don't do a whole lot of preventative medicine in our clinic, but yeah, I would definitely defer that to your primary care doctor as to what medications would benefit you in diabetes.
All right, very good. A question out of Sanford, I believe. This caller's belly button is now sticking out, and it hadn't before. What might be causing this?
Sounds like it might be a little bit of a hernia. Sometimes you can develop a weakening of the body wall. That can certainly cause a bulge there. Provided that the bulge itself isn't painful or hard or reddened on around the outside of it, it probably can be followed up by either a surgery doctor or primary care doctor. If at any point it does become significantly painful, hard, if you start developing rectal bleeding, those would be reasons to seek medical attention immediately.
All right, very good. We have another question via Facebook. You can reach us on Facebook via Ask the Specialists. Is there a need for circumcision anymore? The question via Facebook today.
I don't get that question very often in the emergency department.
Yeah, I wouldn't think so. I wouldn't think it would be an emergency. If you want to share a comment, feel free. If not, we'll move on.
Well, typically there are you know, several nationalities that don't circumcise at all and do just fine. So I think it's more of a fitting in with everybody else issue at this point, I think. So
very good.
Medically, I don't know that there's a major issue. Sometimes with diabetics, they can develop infections later on in life. So sometimes that would be medically necessary, but for the most part, no.
All right. A question out of Waterford, a 33-year-old female who suffers from leg cramps, but also severe cramping in the toes and shoulders. What could this be? Is there any sort of extension of the leg issues that we've been talking about, Dr.
Well,
Safady?
I mean, vascular disease can occur anywhere. It can occur in the legs, in the arms, and it can occur anywhere. And it's the same pathophysiology that happens in the legs due to blockage. It can happen in the heart or in the brain circulation or the arms. It sounds, when you start having cramps everywhere in the body, usually it's, from my experience, it's not peripheral arterial disease. And again, patient is advised to do these non-invasive tests to rule out peripheral arterial disease if present. So I would recommend that this patient or this caller talk to their primary care provider and get tested.
All right, very good. We have just mere moments. Dr. Wilkerson, this female patient has iron infusion treatments, or they're noted to be needed. What would happen if this treatment is refused?
Well, typically iron deficiency is used to treat, iron therapy is used to treat iron deficiency anemia of some sort. There are other options, certainly discussing that with your hematologist or regular primary care physician would be appropriate in that regard. All
right. Very good. The time flies by, does it not? Folks, we want to thank you for all of your questions. We had so many that we didn't get to. We'll try to answer some more of those via our Facebook page. I want to thank our guests, Dr. Rami Safady and Dr. Daniel Wilkerson, both with McLaren Central Michigan, and of course our telephone operators and all of our crew here, of course, but also for you, because without your questions, we don't have a program. Thank you very much for joining us for Ask the Specialist. It's Ask the DNR next week.